Well, the opioid crisis has reached into the lives of countless families, but it's also had a significant effect on doctors as they change their approach to treating pain.
Our Dr. Frank McGeorge, of course, has a unique perspective as a practicing emergency room doctor and our medical reporter, and joins us from Henry Ford Hospital with more. Frank?
Well, you know, Devin and Kimberly, I have seen it from the inside. And from the time that I started practicing medicine to now, I have seen narcotic problems evolve from heroin, which remains a problem, to really prescription narcotics. And frankly, that evolution was created by the medical establishment, from drug companies to some well-meaning doctors, and frankly, some unscrupulous doctors. But now, we all need to be part of the solution. Now, pain of some sort is the #1 reason that people see doctors, which means doctors' offices and emergency rooms like mine are ground zero in reversing this deadly epidemic. And the changes that doctors like me have already made will affect virtually every patient we see. Dr. Angela Pugliese is a colleague seeing patients in the ER on this day. So do you think this opiate epidemic has changed your practice?
Absolutely.
What are some of the issues that you've even faced in one shift today?
3 different patients with chronic back pain being managed by 3 outside doctors that I then have to determine a different plan of treatment.
These cases are difficult because we don't want to leave patients in pain, but we have to recognize the potential for abuse and addiction. And frankly, it's not rare. So you're working today. How often has this even come up in this one shift?
I've been here since 7 a.m., so I probably would say 4 or 5 times just today alone.
Dr. Giuseppe Parada, another colleague, is very direct.
And it's an open and honest conversation. Sometimes it doesn't end well. Most of the time, they tend to understand, and I've done everything I can to help them.
If the pain is from an urgent threat, it needs to be addressed, but patients and doctors need to change their mindset about pain.
But one thing we have to be humble about, I think, is that I tell patients is that we cannot eliminate pain to 100%. That's just part of the human condition.
Dr. David Kim is a pain management specialist at Henry Ford Hospital. Like me, he remembers the rise of powerful prescription narcotics, names like Vicodin, Lortab, Percocet, and OxyContin. These quickly became the go-to drugs to control pain. He believes it's important to understand how the situation grew out of control.
Taking you back to the 80s and 90s, okay? It was a perfect storm where everybody was guilty. Everybody had their hand in the cookie jar.
Doctors wanted to help, drug companies wanted to sell product, and even federal agencies were on board.
But at the same time, the government got involved and said, doctors, you have to treat pain more aggressively. It was mandated, okay, through hospitals, and it was a big push for that.
There was some very early research suggesting addiction shouldn't be a concern, but boy, was that wrong.
What we've done, literally, is done the largest experiment in human history on 300 million people. And we've been doing it for 30 years, and now we have data. And the data is not very pretty. It's very easy for ordinary people to get hooked on these drugs.
This means as doctors, we need to change how we prescribe in very real ways.
It used to be a common shift practice that a lot of patients walked out with opioid scripts, and now it's a handful at most.
As physicians, if we do decide to initiate opioids, we have to do our due diligence to protect society, patients. You need to look at the medical history. You need to assess the risk.
And when we do use opiates, we dispense fewer pills and we choose the least potent or addictive medication that'll manage the pain. Now, another reality of practicing medicine is that doctors also need to play detective when it comes to patients that have chronic pain or any suspicion of addiction or abuse. In fact, many states require doctors to run a patient's name through a database before prescribing narcotics. And all but one state encourages doctors to look up a patient's prescription history in a system like this one in Michigan.
There's a small minority of patients who are drug seeking that will come to any doctor's office, and those are fairly easy to see. But sometimes, you have to be brave and say no, because of one thing we as physicians have is a duty not to only protect our patients, but we have to protect society as well.
But saying no isn't always straightforward.
You get called names on a regular basis. Plenty of people scream at you.
And according to research Dr. Kim has published, the risk can be greater.
But the #1 cause of violence toward physicians in the pain group had to do with opioids. That the precautions that some of these pain physicians have done, some of them carry guns in their offices. Some of them carry body armor. Some people have security systems within their offices. But like I said, you know, this is the world we live in nowadays.
Yeah, and so, you know, all of this means patients should expect more direct, candid discussions about why narcotic pain medications are dangerous and shouldn't be used without some careful consideration about the real risks involved. Reporting from Henry Ford Emergency, I'm Dr. Frank McGeorge. Back to you.
Now, Frank, I know when you're working in the ER, you often see patients coming in and they even ask for drugs by name. They know what they want.
Well, that's absolutely right, Kimberly. And, you know, generally in the emergency room, especially when someone asks for a narcotic by name, that throws up red flags for abuse potential. But that really oversimplifies the problem that all physicians are facing. And that's trying to identify when a patient just knows what works for their particular real pain versus trying very hard to avoid feeding that epidemic beast. And frankly, there is just no easy answer at this point.
All right, Frank, we'll be back to you shortly.